Hello, my name is Melanie and I am the Total Joint Coordinator here at Aurora Medical Center, Sheboygan County. I am here today to highlight the most common things that occur following a total joint replacement as well as frequently asked questions. Here I have listed my contact information and hours. My hours are Monday through Thursday, 7:30 to 4:30, and Fridays from 7:30 to 11:30. You can reach me at 920-828-2591 or by email at melanie.funk@aah.org. If I am to be out of the office, I will state this on my voicemail, so please listen to the voicemail fully. In most total joint cases, you will receive spinal anesthesia. Some of the possible side effects from this anesthesia can include tenderness at the injection site in your lower back, difficulty urinating. Your bladder is always the last thing to wake up. You may also develop a headache a couple days after this injection. Nausea and vomiting, dry mouth, muscle aches, confusion are all normal. And you may also have a sore throat if you had general anesthesia and a tube was placed. After your total joint replacement, you will obviously have a surgical incision. If you have had a total knee replacement, you can remove the ACE bandage and any white gauze 2 days after your surgery. Leave the dressing that has silver down the middle on. After removing them, you will then put your compression sock on that surgical leg. Remember, the compression socks go on in the morning and come off at night. You will wear these until your 2-week post-op appointment, and then you should get the okay to stop wearing them. The dressing you have on will be clear with silver down the middle of it. Never remove this dressing. If this dressing becomes 75% saturated or starts to leak, we will want to change it. Do not go to the urgent care or the ER for this. It is not an emergency. If it begins to leak, just reinforce it and call to get it changed. If it occurs over the weekend, just continue to reinforce it and call first thing Monday morning. This dressing is also waterproof, so it is okay to shower, but do not let the water beat directly onto the bandage, and make sure all 4 sides are sealed and intact. No tub baths, pools, or hot tubs until you get your surgeon's approval. I recommend getting Glad Press and Seal and placing that over the bandage when you shower, just as an extra precaution. Also, if any type of fluid collects in the silver portion of your bandage, it may look yellow, black, red, or green. This does not indicate an infection. If your bandage starts to roll up on any of the sides, just use some tape to secure it again. Total hip replacement patients. If you had the posterior approach where the incision is toward the back, then you will have precautions that you have to follow for 6 weeks to prevent dislocation. If you had the direct anterior approach where the incision is towards the front, these precautions will not pertain to you. Do not bend past 90 degrees, such as tying your shoes or picking up something off of the floor. No twisting or pivoting. Do not cross your legs at any time. That includes your ankles. Use a raised toilet seat or portable commode if your toilet at home will not be high enough. And I suggest placing a stiff pillow between your knees when turning in bed. Here you will see a list of symptoms and recommendations to help relieve these symptoms. It is very normal to have stiffness and pain. Moving frequently, icing, and taking your pain medications as prescribed should help. It is normal to have bruising and swelling, and it can go clear to your toes. It does not always occur right away and can show up several days after surgery. The swelling may seem extreme and may even cause some blistering, but this is also normal. If you do get some blisters and they rupture open, just cover them and keep them clean and dry. It is key to keep your leg elevated when you are not up and about. It may be red and slightly warm around your incision. This will dissipate with time, and ice can help alleviate the discomfort. A low-grade fever less than 101 degrees is also normal. You will have pain. We are just trying to keep it tolerable. Take the pain medication only as prescribed. Remember, it takes 45 minutes to 1 hour for the pain medication to kick in, so don't wait until it is extreme. I also recommend taking a pain pill 1 hour prior to physical therapy. You must count your pain pills every Thursday morning, and if you do not have enough pills to make it through the weekend and at least part of Monday, call on Thursday, as we generally do not do refills on Friday. The first pain medication you will want to stop is the hydrocodone or oxycodone. It is a good idea to eat a little something when you take your pain medication, as it can really upset your stomach. It can be some crackers, yogurt, anything small. Do not consume alcohol while you are taking pain medications. If you have any issues with pain control, do not hesitate to give me a call. I have tips and tricks that can be tried. If you do not have pain, do not take the pain medication. If your pain is mild, you can try over-the-counter pain relievers such as Tylenol, which is also called acetaminophen, or ibuprofen, also called Advil. Just remember to keep track of your total Tylenol intake in a day, as you cannot have over 4,000 milligrams and you cannot exceed 3,200 milligrams of ibuprofen in a day. Each hydrocodone or oxycodone tablet generally has 325 milligrams of Tylenol in it. Look on your pill bottle and it will state 5-325. That indicates that there is 325 milligrams of Tylenol in each tablet. Your nurse will review any specific medications with you before you go home. Your pain medication can also cause constipation, so be sure to have stool softeners on hand, such as Colace, Miralax, Senokot, or Dulcolax. Just follow the directions on the package. Here are a few things you can do to help prevent constipation. You should always be drinking plenty of fluids. Get up and move around frequently. Eat a high-fiber diet, lots of fruits and vegetables. And if you have severe discomfort and haven't had a bowel movement in 3 days, you can get a medication over the counter called magnesium citrate. I would not take this medication on a day you have physical therapy and you're going to want to stay near the restroom. Moving is essential. The worst thing you can do is go home, sit in your recliner, and only get up to use the restroom. Then more than likely we'll be seeing you back in 3 to 4 months for a manipulation if you had a total knee, and then you'll start all over again. You can bear as much weight as tolerated. You are not going to hurt those implants. You should get up and walk around every hour. I advise at the top of every hour to get up and walk around a bit, then sit down, elevate, and ice for 20 to 30 minutes. For a total knee, make sure you ice not only on top of your knee, but behind your knee as well. Walking is one of the best therapies for a total hip. You need to continue to do the exercises you were given 2 to 3 times per day. There are some exercises you may not be able to do right away, but continue to try and it will come eventually. Never miss physical therapy unless instructed by the surgeon or our office. Generally, we say no driving for the first 2 weeks and then use common sense. Absolutely no driving while you're taking pain medications, and make sure you can hit the brake hard enough and fast enough in case someone pulls out in front of you. You may not have much of an appetite after surgery, but it is important to eat to get nutrients and to also coat your stomach for the pain medications. You do not have to eat 3 full meals a day. You can eat several small meals several times a day. You should start off with clear liquids such as water, juice, ginger ale, or broths. Then you can move on to a bland diet such as toast, crackers, sherbet, soup, or hot cereals. Then advance your diet as tolerated. Remember to always eat a little something when you take your pain medications, and also eating a high-fiber diet can help to prevent constipation. Signs and symptoms of infection to watch for include the following. The area around your incision looks angry, is deep red, and looks like it may be spreading. The area is hot to the touch. Remember, warm is normal. If you have a foul-smelling drainage, if you have pus-like drainage, and the biggest telltale sign of an infection is a fever of 101 degrees or greater for more than 24 hours. If any of these occur, then call our office. The only fight we have against blood clots are the following. Taking the blood thinner the surgeon prescribes, it is usually a baby aspirin or Eliquis. Take them as prescribed and for the duration prescribed. Getting up and walking frequently helps to keep the blood flowing. Wearing your compression socks as advised, putting them on in the morning and taking them off at night until your 2-week follow-up. And also avoid long car rides. If you're going to be riding a car for more than 2 hours, you need to get out and walk every hour. Signs and symptoms to watch for a blood clot are calf pain, severe calf pain when you're standing, redness in the calf area, or a lump appearing in the calf area. If you have shortness of breath, chest pain, or trouble breathing, you are to call 911 immediately. You cannot go to the dentist for 3 months after surgery. If there is an emergency, you will need to call our office to get an antibiotic you will have to take 1 hour prior to going to the dentist. After the 3 months, you will not need an antibiotic to go to the dentist unless you are immunocompromised. For example, you have rheumatoid arthritis, insulin-dependent diabetes, cancer or being treated for cancer, HIV, or have had an organ transplant. You may also have trouble sleeping after your surgery. Try to stay awake for most of the day and not take many naps. Most people start out sleeping in a recliner as they find that more comfortable. You can also try using Tylenol PM or Advil PM if you're allowed to take ibuprofen products, as these have a sleep agent in them. Remember to keep track of your total Tylenol and ibuprofen intake in a day. Finally, you will be receiving a survey either electronically or via mail. Please take the time to fill it out and be honest. This is the only way we know about things we can improve upon and ways to commend our staff on a job well done. Again, here's my contact information, and don't forget we are only a phone call or an email away. If I am unavailable, you can also reach our triage nurse at 920-828-2590 Monday through Friday, 8 a.m. to 4 p.m. After hours or on weekends, you can call 920-457-4461 to get an after-hours triage nurse. Now press your call light and your nurse will come in and finish up your discharge.